Look at the clinical features of shoulder dislocation. Clinical features of shoulder dislocation. So, the clinical features is more of like if somebody has a shoulder dislocation, what are they likely to complain about? And also, when you examine them, what are you likely to like pick up for yourself? What the patient complains about is symptoms. What you are able to pick up by yourself is the signs, right? So clinical features is like the signs and symptoms. So for shoulder dislocation, we have it as follows. So it typically presents with, in summary, the patient will complain about pain. Of course, it's the pain that will drive them to the hospital. A patient could have shoulder dislocation and they are not able to use the hand efficiently, but they could still be at home for a while. Okay, what usually brings them to the hospital is the pain, right? So there's deformity of the shoulder contour, there's swelling and bruising, and there's of course inability to use that hand the way you used to use the hand before. So the features in in detail now. So general presentation is history. When you ask the patient like what caused this, they will possibly tell you things like all those falls, sports injuries, motor accidents, and the pain they are feeling is usually intense, you know, and there's loss of function. They are not able to use that part of the body like they used to use before. Okay, so you could see this is a there's lots of the rounded contour. So instead of your shoulders to be this round, it is just flat like this to show you that they have not been using that part of the body that much. Okay. So local signs include deformity where there's flattened contour of the shoulder, loss of roundness. Instead of it being round, it's rather flat. Can you see that? Okay. So prominent acromion. So this tip is so prominent. Normally, your muscles should be covering it, but it's so pointed out. So arms are usually what slightly abducted. Can you see the way he's using his other hand to support the other arm? So that's the classic position of somebody that fractured their shoulder. Okay, they can't be able to just let that hand just be. Okay, it's too heavy. Can you see the way you swing your hand? It's not heavy to you. When it fractures, it becomes heavy though. So swelling and bruising, when you actually examine that side, you basically see a lot of, injuries, okay, to confirm. So tenderness too, it's marked over the anterior and the posterior shoulder, and this is actually depending on the, you know, dislocation type. Okay, it could be to the back, it could be to the front. To the front is anterior shoulder dislocation, to the back is the posterior shoulder dislocations. So for the neurological and vascular features, the nerves, neurological as the nerves, they could be injured. Vascular as the blood vessels could be injured too. Okay, so the nerves, when they are injured, there's numbness, there's tingling, there's weakness. Because nerves carry the sensation. They help you move your muscle. So you could actually lose those abilities. So axillary nerve is the one that is mostly what's injured, and there's regimental badge. So over this side of the shoulder, the person is not able to feel any sensation. I know when you were in school, they used to put all those scouts, boys brigade, they put badges here. So that's why they call it the regimental badge injury. So on the blood vessel, it's rare, but the person could bleed, if it occurs. So types of dislocation again, we have the anterior one, which is in 95% of cases. You find the anterior shoulder dislocation. Then also we have the posterior shoulder dislocation. Then we have the inferior shoulder dislocation, which is rare. Our staff, who is an orthopedic staff, is over close to 60 years. He said that he has been practicing medicine for over 20 years. He has never seen an inferior dislocation, right? But you always talk about it because it exists in some rare cases.